An overview of the current state of men's health. Let's look at a global perspective and even nationally and regionally. What are we looking at in terms of how serious this burden is?
Yeah, thank you very much. First and foremost, mental health is ability to handle everyday stress, the ability of someone to also contribute to their community, and the ability to also for them to learn well and work well, and also to in a way cope with stresses and realize your abilities. When it comes to men, men's mental health has been a topic that has been dear to me, because men's mental health presents very differently, and statistics worldwide show that there is a lot of issues around men. Number one, a study around a survey of 1,000 men in the UK around 2021 showed that up to 77% of men had at one point symptoms of mental health issues. Out of that 77%, close to 40% had never spoken to anyone about it. And most of their challenges were around work-related stress, family-related stress, and also to do with their physical health. When we come closer home in South Africa, there is also a survey that was done in 2019 that showed that out of 13,000 deaths due to mental health issues, either death by suicide, death by complications of mental health problems like alcohol use and substance use disorders. Out of 13,000 deaths, 10,000 deaths were men-related deaths. When another study done in Uganda showed that the biggest problem that men are having are emotional regulation, and also the problems with emotional awareness and processing. So men, we have not been wired, or we have not been nurtured to express our emotions and to understand what our feelings are.
Yeah.
In Kenya, in 2022, there was a report that showed that compared to 44% of women who have at one time in their life had mental health challenges, the men who have had mental health challenges that are close to being a disorder that needs treatment were at 57%. So you can see that's a big difference. When you also compare when men present with the symptoms of suicidal attempts, so 3/4 of patients with suicidal attempts are women, but 3/4 of those who attempt and end up dying by suicide are men. So despite men having less attempts, they end up having more deaths by suicide. When it comes to alcohol use, for example, and up to 6% of Kenyans struggle with alcohol use disorders. And out of that 6%, out of every 10 men, one woman suffers with alcohol use disorder.